If there weren't programs like IWES program, the city would be in a chaotic state because many teens rely on our programs. Many teens really enjoy the outreach that we provide to them.
On February 22, 2011, the Institute of Women and Ethnic Studies organized a press conference to recognize 6 Louisiana organizations that received $30 million in grants from the U.S. Department of Health and Human Services Office of Adolescent Health. These grant funds were received to implement teen pregnancy prevention programs throughout Louisiana.
There were over 1,100 applications received by the Office of Adolescent Health, and only 92 were funded.
Tulane University, Louisiana Office of Public Health, HIV/AIDS Program, the Institute of Women and Ethnic Studies, Louisiana Department of Health and Hospitals, Office of Public Health, Louisiana Public Health Institute, and the Central Louisiana Area for Health Education Center.
During the press conference, attendees were treated to inspiring words from several specially invited guests and elected officials, as well as our host, Dr. Andre Perry.
When I came in this morning, I was just elated and able to see people that I haven't seen in a long time, but people who I know have continued to work in this arena and do good things for our children in Louisiana.
We're very proud that we're actually one of few CBOs nationally to have received one of these grants from the Office of Adolescent Health. And we're going to be implementing an evidence-based program called Making Proud Choices, which is targeting African American and Latina youth ages 11 to 13. We have the young ones in Orleans and Jefferson Parish. And similar to what everyone else has said before, we're really trying to empower young people, help them find that place in themselves that will help them to make healthy and proud choices, that they can achieve their goals, and that they will minimize their risk for infection with HIV, STDs, and pregnancies at an early age when they're not equipped to handle them. We're also very proud in our program. We are going to be addressing some of the mental health issues. Our organization works a lot in the schools, and we see what's going on, and so we're going to be having a couple of modules in our program that addresses some of the mental health needs of youth, and we're going to be using a positive youth development framework. Again, we're so excited, and I think that this is somewhat groundbreaking that we're here as a collaborative to figure out how to work together with the New Orleans community and not to compete. We're here to work together, and we need you to help to support us and to keep us on track when we fall off. Thank you so much.
Happy to be here representing the mayor and bringing the joy that the administration feels in this significant gift that's come from the federal administration to support really important work that's innovative and entrepreneurial and collaborative, which is something we really enjoy and support in the city.
What I really love about this is that it's a coalition of grantees and that we're partnering together to impact teen pregnancy and STDs in Louisiana among our young people. And I think the beauty of this is the collaboration, and to have this much collaboration and resources all focused on teen health.
There's definitely a bridge between the nonprofit organizations and the faith-based organizations. We must bridge together because the children, the young women, the young men, they need us to come together and unify so that we can speak with one voice and have one sound. That's where the strength lies.
Some folks actually define education as building the capacity to make decisions. And I think when we're talking about the Partnering for Teen Health, that's exactly what we're doing. You'll hear a lot about pregnancy, but at the end of the day, it's about increasing the capacity of men and women to make decisions for themselves.
Everywhere I go, and especially the schools throughout District C and in Algiers, I'm hearing from the schools that they need more programs such as this. And the students are also crying out for it, and they need that type of counseling. So again, I'm excited about it for the kids, I'm excited about it for the district and the entire city.
Well, at my school, we have a health class, and a unit in that health class is on sexual health, and that's just like a 2-week unit.
Sex education at schools is really awful. They don't tell you close to anything of what IWES or any other organization will tell you. They only tell you how it looks, if you have gonorrhea, syphilis, or chlamydia. They don't never tell you how you can get it. They don't tell you to go get condoms. They just say don't have sex. And 9 times out of 10, you're gonna go out and have sex and whatever. So it's really awful, to tell you the truth.
I can't wait to work with some of the organizations within my schools, because as was stated in the press conference, that a lot of kids' lives are outside of schools, and so we need organizations to work with us when they leave campus, when they leave their buildings, and also to help us with cutting edge information so we can make adjustments to our curriculum so we are teaching the appropriate materials.
I think the wonderful thing about this program is that it's about prevention, both for when we talk about HIV, STDs, and also teen pregnancy. All of that is 100% preventable.
I heard someone mention, one of the presenters mentioned earlier, that there is going to be an effort that is going to be focused on the male, and I really, really like that, because we need to make sure that young men know of the responsibilities that they have.
I think that these programs are extremely important to our children in Louisiana, because we want our children to have a better life and to have a future where they become productive members of our society, and they can be good mothers and fathers to their children. Then we need to have more of these programs.
I have 3 daughters, 16, 13, and 11, and I am always trying to empower my girls to make better choices. We cannot blame people for the things that we do. We have to make a decision about everything that we do in our individual lives.
Some children are not really comfortable talking to their parents, and if they don't talk to their parents, they're going to either do the wrong thing or don't do the thing at all. But if they decide to do, have sex, and they want someone to talk to, they can go to IWES.
Anytime we have an opportunity to talk to young people and to advise them of the kinds of decisions and the impact that those decisions are going to have on them for the rest of their lives, as far as pregnancy is concerned, and specifically as far as teenage pregnancy is concerned, we need to take advantage of those opportunities. So I certainly want to congratulate the grantees for the grants that you're going to be receiving. As the chairman of the health committee for the city council, I look forward to working with you, with my committee, to doing whatever we can do on the city level to assist you in any way, shape, or form that we can.
So again, thank you all for coming. This is a tremendous opportunity for New Orleans. Thank you.
IWES is a real safe zone, and I like it. I love it. It's awesome.